September marks Suicide Prevention Month, a time to highlight the important identifying factors that may lead someone to consider self-harm. WCNC Charlotte's Bria Smith spoke with a local doctor who's helping detect these signs and sharing what folks can do to improve mental health.
The CDC reports suicide is one of the leading causes of death in the United States, but is preventable. It's why doctors say it's important to recognize the signs.
The most obvious is the direct statement online, or a meme or a post that includes some type of theme of death or dying. But then there's a lot more subtle ones. People who begin to withdraw and isolate.
A study done by the North Carolina Department of Health and Human Services lists suicide as the second leading cause of death for kids ages 10 to 18 in the state. Dr. Brian Micah with Piedmont Medical Center says students deal with all kinds of challenges.
Like trauma, kids who have been bullied by peers, kids who are the victims of trauma at home, physical, sexual abuse, things along those lines. That's where screening and talking with school social workers, school psychologists, teachers is crucial.
Schools have become another avenue for suicide prevention. The North Carolina Department of Public Instruction has a mental health initiative which serves as a partnership between counselors and psychiatrists. The South Carolina Department of Education AWARE program increases awareness of mental health issues among students and provides training for school personnel to detect and respond to mental health issues.
Second only to the parent, is the teacher really, who's going to see them every day, recognize changes. They're the ones that have to have people and resources to turn to. Hey, can you check in on this child?
If you or someone you know is struggling with their mental health, you can call the Suicide and Crisis Line at 988. And for additional information on suicide prevention, be sure to visit our WCNC mobile app. Bria Smith, WCNC Charlotte.